Thank you. Okay. So my name is Ana García. I'm the CEO of Bitsphi. We are a clinical stage startup in the field of ADHD diagnosis, and we want to make it more affordable and more reliable. Imagine that the psychiatrists today, they had the equivalent of an X-ray to traumatologists. This is exactly in the field where we are working. We want to shift the behavioral lens of cognitive disorders diagnosis to a biological lens. For instance, if you go to a traumatologist and you have broken your wrist, they will ask you, okay, can you move it? They will analyze all the symptoms around it, but until they do the X-ray, they don't know if the bone is broken or not, right? Something equivalent has to happen in the ADHD diagnosis, and this is where we're working. I mean, Beatriz already mentioned and gave a great talk about ADHD, but ADHD today is not just the lack of attention. It has really long-term consequences for all the children along all the journey. So this is why diagnosing it in a timely manner and bring the right treatment to children is so important. Otherwise, it could bring to depression, anxiety, frequent problems at school, even unsuccess, and high mortality rates when it really reaches the adulthood. How is ADHD diagnosed today? It is only done by either questionnaires that they are filling by parents and teachers and a clinical interview. So the misdiagnosis rate is so high. So our research has confirmed that it's around the 20 to 30% of the cases. What does it mean also for parents? So in the end, they have to wait maybe 8 or 12 months until they really are referred to the right doctor. And also, if you think on the treatment side, and this is where the concern of the medical community comes, 23% of the children, they are either not getting the right treatment that they have to, or they are over-medicated. So there are really a lot of concerns. So it's not a niche where we are talking about 120 million children. So according to our calculation, 30 million will be incorrectly diagnosed. Now close your eyes. Think for a minute that you could diagnose ADHD in just 20 minutes with one single doctor and with more than 90% accuracy. That's Bitsphi. How does our system work? A child has to conduct a 20-minute task while wearing a 64 semi-dry electrode system. This task is mathematized, so I will explain a little more about our origin later, but we are mainly telecommunications engineers that are using telecommunication science to understand how the information flows in the brain, right? So during these 20 minutes, it's not just resting, we have a patented task and a patented biomarker. So during these 20 minutes, the child has to conduct the task, and all this information is extracted and sent to the cloud. And automatically, a report is generated with a probability of having ADHD, a brain communication map of our biomarker, and also some behavioral metrics. They are not included in the algorithm, but we are aware that they are very important for adoption because doctors, as I mentioned before, they are really used to working with behavioral metrics. What is our value proposition? We can make the diagnostic process faster, more reliable, we can reduce the waiting list, and we are selling to healthcare providers, so we are making also the whole process much more cost-effective, which allows healthcare providers to allocate the resources in the clinic in a better way. And the peace of mind of families, increased trust. Do I have to medicate my child? Of course, if I see that something is wrong with the connectivity, well, not wrong, it's different to the connectivity, sorry, I will be more, or I will have the trust to medicate my children. What is our science, right? So what you can see there is also part of our IP strategy. We have patented in the US and in Europe. And basically what we see, there are two areas of the brain that they are called the dorsal attention network and the ventral attention network. The way these two networks communicate with each other is much more efficient in a control than in an ADHD. So we are building our product around this biomarker, which is the impaired communication between these two areas. We have different type of competitors. One are the typical computerized tests, where we can differentiate ourselves by bringing the first innovative biomarker, which is independent of the observer. And we also had one competitor in the US that was also doing EEG, but we have a complete different system because we reconstruct sources, we really look at the functional connectivity, and it's a complete different technology. I can explain that. What is our pathway and our market? So we're not just reaching the 129 children that I showed, that it's already very big, but we are, in our pathway, every child that has a suspect of ADHD, meaning symptoms compatible with ADHD, will require this test. We have calculated, and this is like 5 million evaluations per year, only in the US and Europe, and it's a 1.5 billion opportunity. Our validated business model has been discussed with several healthcare providers in Europe and now in Brazil. And basically, we have a fixed cost per test with the option of revenue sharing. We are aware that several healthcare providers, they do work under this framework. Yeah, so we have an opportunity to lower the cost of ADHD diagnosis by 83%, which means the throughput can increase by 4.5. And we know that with our system can work with any EEG in the hospital, that they are already used for epilepsy or sleep disorders. But in the case they really want to invest in a new one, so the ROI is from 7 to 12 months and a few tests, so 100 tests to amortize. Who are we? So I was mentioning it before. So the company was founded with the head of psychiatry of the Puerta de Hierro Hospital in Madrid, which is Hilario Blasco, Álvaro and Miguel, who are telecommunications engineers from the Universidad Politécnica de Madrid. And they joined forces in 2021 and raised a 3.85 million round and founded the company. In all this period, what we have done is to validate our technology. So we have conducted a 165 children study where we have achieved a 93% accuracy in diagnosis. And we have built a great team. So from Professor Jan Buitelar, with his a board member of the World Federation of ADHD, Dr. Jose Angel Alda, who is an outspoken doctor of ADHD from San Juan de Deu. We have been also selected as the first cohort for the Pediatric Innovation Incubator in Stanford and San Juan de Deu. And so we're very proud. And we are right now seeking a 3.7 million round, which will transform our, let's put it, MVP to a commercial product. We are a medical device, so we are class 2A medical device, diagnostic aid system. And we require an additional validation study of 253 children. So meaning that we will reach the market in 1.5 years. And, but this will give us 2 years of runway. And our current investor is Bullnet Capital, which is a deep tech fund based in Madrid. And we are currently looking for an additional investor to join us in the journey. So thank you very much. I would love that our technology reaches the market and we can really help these millions of children that nowadays they need this help and they need to be properly diagnosed. And I wish that everybody here joins our revolution. Thank you so much.
Thank you, Ana. Thank you very much. So let's wait if there are some questions from the public. Yeah.
Hey, thank you. Did I understand right? The device itself is know-how or not? Like the device?
I mean, right now we're using semi-dry 64 electrode, but it's not our core competence. But we're using it because it's very child usable. So as you can imagine, an ADHD child really struggles with gel solutions. But we can be compatible with any 64 and also 32 electrodes. So that's why, in the end, our core competence is the software.
Is it possible to send it, like in-house, to deliver it, to do the diagnostics inside the house?
That's a very good question, and an internal discussion of where we should be. Should we bring it home or not? And we believe it's, I mean, at least for the go-to market, it's very important that there is a psychiatrist really interpreting, or a neurologist interpreting the results. And so we are opting for a clinical setup, not a home. So in the end, it's 20 minutes. It's like doing an X-ray, right? So right now, or if it's a test prescribed. So it is very short. It's already okay, and healthcare providers, I mean, they really want this to be in a hospital setting. So.
What's the price to send it to somebody's home?
You mean the test? I mean, right now, you have the EEG test, the EEG hardware, which is like 50 euros per case, more or less. And then you have the personal cost. Maybe I should have said it, the user of the EEG, right now, they could be any lab technician, any nurse, or any neuropsychologist in any clinic. So all the 200 children that we have so far, the EEG has been conducted by neuropsychologists with no previous EEG experience. I agree that bringing it at home, it could be at some point, because we are seeing that, but not for the diagnosis, right? I think probably what makes sense is to have the treatment at home, or the monitoring at home, but to go to a clinic for a diagnosis and in the end have the opportunity to meet a doctor, I think is still the case. And
what's the main barrier to do it at home?
It's not a barrier. I think it's really, I mean, what would be the benefit versus an already existing system in a clinic right now? You mean that
to make it super easy to ask delivery from the website, to have diagnostics?
Okay. That would be a B2C model, you mean, right? Yeah. So, well, I mean, I will not say no, for instance, for the United States, because we have seen this B2C model already existing, but I think in Europe, reference labs, I mean, if we place this in a clinic that is 5 minutes walk from your house, and it's already, I don't know, like made by Sanitas or Vitas or whoever is the reference lab, probably there is not so much benefit, right?
Cool product, thank you.
Sorry. Hey, Anna, Mishkin here.
Hi.
My name is Mishkin. Cool presentation. I'm intrigued by the software piece.
Yes.
Can you distinguish, using your existing data set, the efficacy of different treatments which are administered? Let's say if I take methylphenidate versus something else, so you can map it out, yeah?
Yeah, that is a very good question, because in the end, I think the goal of Bitsphi is not just labeling the kids and say, okay, you have ADHD or you have dyslexia, that we can also stratificate. We have in the pipeline the stratification. I think we also aim to be a treatment monitoring tool, and by measuring before and after the treatment. But it's not released yet, so we're testing it. So it is in our roadmap, and probably it will be part of our journey as well. Methylphenidate is 80% of the cases, as you know. It is a very efficacious, I think the efficacy is very high, but nevertheless, all the authorities, they want always to have a multifunctional treatment somehow, right? And then I think solutions like Beatriz or equivalent, they should be integrated. And I think where Bitsphi can play the role is by measuring the changes of connectivity. Because right now there is no standard. How do you know if one solution is better than the other? So this is one part, and the second part is to help pharmas develop new drugs. So that there are like, if we look like this picture of the diagnosis, and I think that's our first, but then it can go up to that.
Research tool, got it. Cool, thank you.
Thank you.
So, one last question before we go for the coffee. One last, okay.
Hi there, thanks. I was wondering, is the goal to have just, let's say, the diagnosis via your system, or you will still need a clinical interview? So would it
in the first place, we do need doctors, yes. But I think it will be the gold standard of the diagnosis, and that we aim to be the gold standard, right? So that the doctor sees it and say, okay, look, the impaired communication in these two areas is like the differential diagnosis that I will definitely support. But yes, in the end, the doctor still needs to do that. But all this efficacy has to do because in the end today, they really need to visit 4 types of experts, from neuropediatricians here in Spain, that they are neurologists, they are not psychiatrists. They do have to see for several hours a neuropsychologist. That is also very expensive, so eye test will be cheaper than a neuropsychological interview. And then they have to get to the expert. So in the end, that's why we make it faster. So we don't put it to 0, but I think it's